Healthy Living in the Four Corners is brought to you by San Juan Regional Medical Center. Many a baby boomer like I can remember attending measles parties when we were young. When a neighbor's kid came down with the measles, moms would expose their children so that they could contract the virus and get through with what was then considered part of growing up. What they did not consider was that 20% of children who contract the measles were hospitalized. 1 out of 20 would come down with pneumonia, the leading cause of death from measles, and 1 to 3 out of every 1,000 children died from respiratory and neurologic complications. That's why pediatricians with San Juan Health Partners Pediatrics are urging families to vaccinate their children as school starts, especially with this past year's record number of cases. Although school children have been vaccinated against diphtheria, pertussis, tetanus, and polio since the mid-50s, measles vaccines didn't become part of the regular childhood pantheon of immunizations until the late 1960s. And by the year 2000, the Center for Disease Control declared measles eliminated in the United States. But this year, more than 1,200 cases in 31 states have been reported to the CDC since January 1st, the greatest number of cases reported since 1992, 8 years before measles were declared eradicated. The majority of cases were among people who were not vaccinated against the disease.
So that's probably the number one problem right there, is that the vaccine program has been too successful. So we don't remember our grandparents having polio or seeing people die of measles and all these other diseases. So with it being so successful, people don't believe they need it anymore. And there's the notion of herd immunity, where if enough people are vaccinated, those that aren't vaccinated don't get the diseases as frequently. However, we can see that having problems now with the measles outbreaks. Not enough people are vaccinated toward the measles. We thought it was eradicated. That's not the case. Enough people aren't getting vaccinated now, or their immunity is wearing off over time, so more and more of us are susceptible to those diseases.
While health officials are boosting efforts to educate the public about the importance of vaccines, they're also trying to allay public fears about now discredited studies linking vaccines to autism. As a result of the misinformation, much of it spread by the internet, the percentage of families who opt out of vaccinations has risen steadily over the years, and so have cases of whooping cough, measles, and even chickenpox.
Correlation does not imply causation. Autism is typically diagnosed at ages like 15 to 18 months, and of course we're doing most of the childhood vaccines between 2 months old and 2 years old. So that's when we're seeing autism emerge in these young children. It just so happens that they're getting vaccinated at that same time. There has been no link ever proven. There's a Danish study and many other studies done that refuted those claims. Like you said, the doctor lost his license. However, with social media, things spread like wildfire, and a lot of it is misinformation. And that's a big problem, because people tend to go to social media for their science rather than scientists or studies that are well established.
According to the Colorado Department of Health and Environment, only 85% of Durango students were reported up to date on their vaccinations last year, compared with 89% statewide. New Mexico's vaccination rate among school children is 99%. Childhood vaccinations include inoculation against diphtheria, whooping cough or pertussis, tetanus, polio, measles, mumps, rubella or German measles, and chickenpox. Palmer also encourages parents to check on boosters for their teenagers and for themselves. And parents should have their teens vaccinated against the human papillomavirus that has been linked to cancers of the reproductive system. Inoculating students with the recommended vaccines before the school year not only protects individual children from potentially fatal diseases, but also protects their school communities and the community as a whole, particularly the very young and the elderly.
It would be great if everyone thought about the world as a whole. If I choose not to get vaccinated, I may, like this season for instance, get the flu, and I could spread that to a newborn that could then die of the flu, or an elderly person that dies, although I got better. So if we could think about it in terms of the global community, I think that would be great. If you want to protect the old, the vulnerable, the young, it's so important for everyone to be vaccinated. So it's a catch-22 living in a free society. We get to choose, but our choices have consequences. And is it fair for your child to go to school without any vaccinations and potentially take a disease that could infect everybody else or infect the vulnerable? You know, now we live in a land where we have clean water, we hopefully wash our hands, and we have vaccinations. And because of that, we live to be 90 years old. If it weren't for those three things, we wouldn't be living so long. So I just encourage everyone to take that into consideration, get good information, and vaccinate.
Check with your pediatrician about immunizations for your child, and to learn more about back-to-school wellness visits, go to sanjuanhealthpartners.com/pediatrics. I'm Deborah Uroda for Healthy Living.